it was really hard because you are really facing short staffing. At the same time, you will be catering different areas. You're going to split the staff into different areas. And you are actually faced with the challenge of how are you going to maintain patient safety? Is your numbers enough? Have you got the right mix of staffing? How will you actually decide on that?
Well, because of the pandemic, people tend to get sick often, and the number of patients being admitted in the hospital increased over time, and also the risk of infection. So you have to be very, very observant. You have to be very, very very meticulous in everything, because one little mistake can, put yourself or a patient at risk.
In pandemic time and flu time, winter time, it's a big crisis time. Staff shortage, we international nurses, some of people, all like senior nurses in our own ward, sometimes with agencies, like full base are full heavy. We have 1 or 2 stroke patients. I was wondering where all stroke patients has gone even at that time, because all are medical conditions like fever, respiratory problems, all scoring patients, escalations, emergencies. Day and night was like same for me, to be honest.
Standing here on the shore, I can really say I did my 100%. I could put my 100% in the pandemic, and as a nurse, I am really happy I could do something when the world was really struggling.
During this pandemic, especially these old people, majority of these patients coming to the trust are above 80s and all. They are alone. So I feel that in between my heavy shifts, I was able to give some hand, talking to them was actually great. For me also it was a stress relief, because when we are leaving after the shift, there were so many incidents. They were, oh, you're not there today. Or then when we were coming to the next shift, they will be asking, where were you yesterday? I just feel that it's something some relatives is asking me why you were not there. And if some patient is being transferred from Telford to Shrewsbury, they will be asking, will you be able to accompany me? So even though it's a hard shift, the innermost part of me is feeling very happy, because, oh, someone is accepting me as a person. So it's a great experience. I feel that I have done a little bit in this country to overcome this pandemic.
It was really rewarding. I think for the past 5 years that I've been here, nurses are just regarded as, yeah, they're looking after my mom, they're looking after my dad. But at the same time, I think last year, because of this pandemic, we are actually massively been lifted up with our spirit, the spirit.
I consider that service to God is service to mankind is service to God. So I got because this is an opportunity not everyone will get. We are exposed to the people, and we can do a lot for the people. So it's not a money-oriented profession or anything else. If we put 100%, and I am really proud that I'll try my best to put 100% in my profession. Yeah.
It's totally about caring, understanding people, understanding their needs, and doing accordingly, and doing our role in the frame of the trust policy. Yes, all about caring people.
I also accept that caring is the primary part, but that made a big change in myself. Like, it helped me to learn and transform me. So I believe along with care, I transformed my way of approaching caring patients, and their well-being is also changed. So I think I achieved a bit more quality care, my self-transformation, a growth, like a bunch of things. a bunch of achievements.
It's not only my victory, but I think it's the victory of the whole department itself, that we actually adopted ourselves with the massive changes, that we really have to understand we have to do this, but we should be doing this, and how we should always be prioritized regardless how short staffing levels were, the safety of the patients. And I've seen how teamwork has actually, it's been there, but it has massively improved how we are actually brought together.
Almost all patients getting well, like in stroke and in non-stroke areas, I saw patients getting very, very well, whole weeks, and queue and coming back to see us, saying thank you. And Christmas we received a man, he survived all that things and he came back with his family. It was our huddle time in night. He delivered a 2 full bags of chocolates and so many things for the staff and their shifts, like not only night staff, for whole staff and also for patients. So I think all that things, little things contribute to a big victory, right?
The thing is that in the pandemic, we know one or the other day, one staff members, if they get affected, the staffing pattern will get changed, and it is really challenging because the rest of the staff members have to work hard to meet all the things. So at the end of the day, if we completed our task without much problem, that would be a great thing. That is a great victory, I feel.
Many situations I have admired the people's hard work there, especially the band 5 and band 6 nurses who are working there, and I could I was inspired by their work actually. It was really amazing.
Seeing my patients recovering and getting back, regaining their health and getting back on their feet and being discharged. I think that's the most victory that I can ever think of. Yeah, not seeing patients that are critically ill with COVID-19, and then you see them, responding positively to treatment, and before you know it, they are discharged home. I think there's nothing that will beat that.